Welcome to Docs on Call, brought to you by Northeast OBGYN.
Good evening. Welcome to the Wednesday edition of Docs on Call. I'm Elizabeth Nolf McDonald. When you have pain, is it normal to hurt? No, it isn't. And that includes pain in the pelvic region. How common is pelvic pain? Well, nearly 1 out of every 5 visits to gynecologists is related to some form of pelvic pain. Pelvic pain can have devastating effects on women's lives, and for that reason should always be evaluated by a physician. And with us tonight is such a physician, specialist in that area, Dr. Christopher Stroud. He is an obstetrician gynecologist with Northeast OBGYN and Parkview Physicians Group. Dr. Stroud, welcome to Docs on Call.
Thank you. It's a pleasure to be with you.
First thing I want to say is we are talking about pelvic pain, but this does not involve just women, does it?
No, certainly. As an obstetrician gynecologist, I only treat women, but pelvic pain that affects women really affects their entire family. It affects their relationships, their spouse, their significant other. So if we have men listening tonight, stay tuned. This relates to you as well.
Another question is, if a pain is in the pelvic region, is it actually pelvic pain?
That's a very good question. You know, there are really basically 2 sources of pelvic pain. One category would be of a gynecologic nature, whether it's the uterus or the tubes or the ovaries, maybe even the bladder. And the other category would be the intestines, or a gastrointestinal source of the pain. A big part of our job is to determine which of those 2 categories the cause of this pain is.
So if a woman has pelvic pain, does she see a gynecologist first, or does she see a GI doctor first?
You know, I would say by and large, most commonly women will come to their obstetrician gynecologist first to determine the source of that pain.
You were talking about pain. I know a lot of women have cramping during menstrual periods. Is that considered pain?
You know, it's interesting. In many ways, pain is a difficult symptom to describe, and we often say it's sort of in the eyes of the beholder. So one woman's pain may be nothing to another woman. I think the best way to try to address that is to ask questions about how the pain affects her life. Does it cause her to miss work? Does it cause her not to participate in activities? Does she have to take medication for it? Is it in any way disruptive to her normal day-to-day activities? If it is, then I would say that pain probably isn't normal and needs to be evaluated.
Now we are talking about acute pain, and we could also talk about chronic pain. Why don't you talk to me a little bit about acute pain?
Sure. Acute pain, or a sudden onset or a rapid onset of pain, different condition necessarily than chronic pain. As you said, we'll talk more about that as we go. But when we think about causes of acute pain, we mean a pain that suddenly starts. It can be severe. It doesn't necessarily have to be constant. It can be intermittent, but it has a rapid onset and is typically severe.
So give me some examples of what would cause acute pain.
Sure. One of the things that we're always concerned about is that of an ectopic pregnancy, or a pregnancy that's in the fallopian tube instead of in the uterus. When that happens, the tube can actually rupture, and even before the tube ruptures, it can cause severe and the acute onset of severe pain.
What about endometriosis? Would you consider that acute or chronic?
You know, most commonly endometriosis is a chronic pain condition. Now, occasionally the level of the pain can become acutely more severe, but typically that's a chronic pain that comes and goes over time.
Now, I know some people with endometriosis, and their pain was lessened when they had children.
That's a very common finding, and I can't say that we actually understand that, but we certainly hear that a great deal.
So talk to me about chronic pain.
Chronic pelvic pain, different condition than acute. We tend to think of 6 months or more of chronic pain to be considered chronic. It doesn't have to be constant. It can come and go over time, but 6 months or more of a painful syndrome, we typically call that chronic pelvic pain.
And what kind of conditions would create chronic pelvic pain?
Sure. Endometriosis, as you mentioned, is a good example of chronic pelvic pain. A condition of the bladder known as interstitial cystitis can cause chronic pelvic pain. Certainly, chronic pain with menses, or the medical term is dysmenorrhea, can be a source of chronic pelvic pain as well.
And I want to say to the viewers, if you have any questions on this snowy, snowbound evening, please call us at 483-8331, and Dr. Stroud will be glad to take those questions. Doctor, what about spotting during pregnancy?
Spotting during pregnancy is never considered normal. Although I say that, it's not necessarily bad news, but it's something that we always evaluate, because spotting can be a sign either of a miscarriage. In fact, we call that a threatened miscarriage. It could also be a sign of an ectopic pregnancy that we've already mentioned.
If a person is pregnant and has pain, and it's maybe not associated with an ectopic pregnancy, what other conditions could bring that on?
Well, certainly...
Not counting, of course, when a person goes into labor.
Sure. We're talking about early
Yes.
in the pregnancy, maybe. Certainly, some degree of discomfort is common in early pregnancy, but any degree of significant discomfort really needs to be evaluated. It's something that a woman should talk to her obstetrician gynecologist about.
We're talking about pregnancy and pain. What about pregnancy in the fallopian tubes?
Sure. You know, the pain that comes with an ectopic pregnancy or a tubal pregnancy, as you labeled it, it typically is acute onset, so it's a sudden onset of pain. It may be more on one side than on the other. It may be associated with nausea, maybe some vomiting, but typically those patients will say they felt fine 1 minute and then suddenly they were in pain.
What kind, you see a lot of women, what is the most common pain that women come in and they come to you about and they complain about?
I would have to say the most common pain symptom that we hear about are painful menses or painful menstrual periods. Typically, women will describe pain that's disruptive. It begins before their period. Maybe it lingers through their period until days after their menses, and it's disrupting their life in a significant way.
Doctor, we have Lynn is on the phone right now, and she has a question to ask you. Go ahead, Lynn.
Yes, if a person has had prior endometriosis and had a hysterectomy and still has pelvic pain, what would you say?
I think I heard you say if a person has had endometriosis and has had a hysterectomy and now still has pain, is that correct?
Lynn?
Yes, that's correct.
Okay.
Yeah, it depends on what exactly was done at the time of the hysterectomy. We know, unfortunately, when the uterus is removed and the ovaries remain with endometriosis, that a significant number of those women are going to go on to develop recurrent or persistent pelvic pain and have to eventually have the ovaries removed. The other thing we have to keep in mind is it could have been something else causing the pain in addition to the endometriosis. So that may require an additional evaluation to make certain that what we think is causing the pain is actually causing the pain.
Does that answer your question, Lynn?
Yes, thank you.
You're welcome. Thank you for calling.
Thank you.
Next up, we have Megan. Megan, what is your question?
Hi, with interstitial cystitis, I know that causes chronic pain, pelvic pain. Does that also cause pain in your hips?
Interesting. If I heard you correctly, I think you said the pain with interstitial cystitis, can it also cause hip pain? And I think that's a very important point, and that is our brains interpret pain differently. And whereas it's very easy for our brain to tell us that our left hand or our right hand hurts, it is not easy for our brain to tell us what part of the pelvis or the abdomen hurts. So it's very common to have what we often refer to as referred pain, and that the bladder is actually the source of the pain, but a patient may perceive that in her hips or in her upper thighs, maybe in her upper abdomen, a lot of different ways depending on the specific circumstances.
Megan, do you have any other questions for the doctor on this?
No, I think that was it. Thank you.
Thank you for calling.
Thank you.
Okay, and up next we have Rachel. Rachel, what is your question for Dr. Stroud?
I was wondering what might be the cause of reoccurring yeast infections?
Sure, reoccurring yeast infections certainly create a great deal of pain and suffering of potentially a different sorts in a woman's life. When we think about recurrent yeast infections, we always want to make sure that it actually is a yeast infection. Very commonly, I'll see patients who have treated themselves maybe with over-the-counter yeast medications for many, many months, only to finally come in to be evaluated, and it turns out it wasn't a yeast infection at all. So the first question we want to answer is this indeed a yeast infection and not a bacterial infection or something else? But certainly, having said that, There are some women that are predisposed to chronic or recurrent yeast infections. Women with diabetes, as an example, women with immune suppression for one variety, one reason or another, often will suffer from chronic and recurrent yeast infections. There is hope, though. There are some specialized treatment approaches and protocols and medications used in various ways that we can address chronic or recurrent yeast infections.
Thanks, Rachel. And doctor, are you a proponent of antibiotics when a person has yeast infections, or probiotics? What is your stand on that?
Yeah, that's an interesting point. You know, antibiotics per se are not used to treat yeast infections. An anti-yeast medication is used to treat yeast. An antibiotic is used to treat a bacterial infection. But the two go together in the sense that many women have experienced, if they take an antibiotic for maybe a sinus infection or maybe a bladder infection, a few days later they experience the signs and symptoms of a yeast infection and need to have that treated. I think the most important thing to take away from that is when you have a symptom, whatever it needs to be evaluated.
Yes, and is the medical profession coming to the point where they are no longer giving antibiotics for some things just because it may cause yeast infections?
I wouldn't say because it may cause yeast infections. I think that we're trying to be much more evidence-based in our approach to many things. The use of antibiotics is certainly a good example of that, and that we try not to use antibiotics unnecessarily because of the problem that we can create resistant strains of organisms that don't respond to antibiotics. So we need to be judicious in our use of antibiotics and make sure that we're using the right antibiotic for the right condition.
That's good to hear. Thanks a lot, doctor. Up next we have Izetta. Izetta, go ahead and ask for Dr. Stroud a question. Izetta?
Yes.
Okay. Do you have a question for Dr. Stroud?
Yes. I'm getting ready to have surgery done. Yes, I'm getting ready to have surgery done for endometriosis and possibly a hysterectomy, and they're going to probably leave one of my ovaries. Will I continue to have pain?
Yeah, that's a very good question, an important one to have before your surgery, certainly. There are various studies that have different numbers that they will quote. In general, I like to tell patients that over the period of your life, if an ovary remains and you have a hysterectomy for endometriosis, there may be as high as a 50% chance that your endometriosis will recur. Now, something to remember, just because your endometriosis recurs doesn't mean your pain will recur. And if your endometriosis should recur, it may be possible, in fact it's very likely, that we could treat the pain by removing that remaining ovary.
How does a person know that she still has endometriosis if she has no pain?
Well, if she has no pain, it's not something that they would have to be concerned with, because endometriosis causes pain, it causes infertility and a host of other problems.
Yes. Izetta, did you have any other questions for Doctor on this?
No, and thank you very much.
You're welcome. Thank you for calling.
Thank you.